This is your Barbados Today Evening News Update for Friday, November 19th. Sir Charles Oftney Cole-Williams, the colourful and outspoken construction magnate, died this evening at the age of 88. Sir Charles passed away at the Bayview Hospital surrounded by family. Educated at the Lodge School, Cole-Williams built the Williams Group of companies with his brother Busy, pioneered construction, mining, dairy farming, horticulture, agriculture, housing, electrical contracting, and more. In her tribute, Prime Minister Mia Mottley said Barbados has lost an entrepreneur extraordinaire who had undying love and devotion for his country. She said Barbados would miss his vision, his spirit, his generosity, and the very down-to-earth way he defended his country. In other news, the Ministry of Health and Wellness has hit the ground running with its mission-critical Saving Lives, Risk Communication and Community Engagement Program. Today, community health liaison officers from the COVID-19 Monitoring Unit and community health volunteers venture to the urban corridor, particularly Wellington Street, St. Michael and surrounding areas, where they interface with residents to hear their concerns about COVID-19 and to assess their practices. Acting Health Minister and Chairman of the Cabinet COVID-19 Subcommittee, Dr. Jerome Walcott, expressed concern about the rising numbers.
All of us have seen the rising numbers, and there's obvious community infection, community spread of COVID. We've seen that over the last couple of weeks, the average median age for persons contracting COVID has dropped now in, I believe it's around 38 to 40 years. Conversely, we've seen that the average age for persons dying, and there have been quite an increasing number of persons dying, is around 65 years. We recognize that we've been doing a lot of good work as it relates to the clinical aspects, the care and treatment, but there's still some things that need to be done. We've been communicating, we've been doing PSAs, but we recognize that we seem to be missing, especially certain targeted groups in our communities. And I think that this is a very important initiative. I see it as giving information and gathering information at the same time, information that then can be used in creating our messages to target specific demographic groups that we want to get at.
Lead coordinator of the program, Arlene Husband, said one of the main objectives of the exercise is to help citizens better understand how to cope with the illness.
As families, knowing that COVID is not escaping anyone, it's no respecter of person, and therefore if we have a better understanding and if they know how to live, as I said, and cope with it, I believe that at the end of this we can get more persons complying, using the protocols, understanding what are the basic protocols, using the hand sanitizers that we'll be distributing. We're also going to be using face masks. So we're going to be with the basics that we want them to understand. And we're also taking the opportunity to find out what are their needs.
Emergency specialist Dr. Brian Charles today acknowledged that the introduction of the safe zones was rushed and the legislation was incorrect and therefore led to wrong impressions. He was speaking today at the Barbados Yacht Club's The Way Forward series, which was held under the theme COVID-19, Facts, Fiction and Fallacies. How do you feel about vaccines?
The safe zones that we want to happen here is that the places of business remain or are encouraged to be as safe as possible, but not affecting the consumers. And let me expound on this a little bit. So a restaurant cannot tell somebody they can't come in. That's exactly it. A restaurant cannot tell someone you cannot come in, and you will see this when this is fleshed out in new legislation in another 2 weeks. A restaurant cannot, at this point in time, tell someone that they can't come in because they're not vaccinated. The waiter who's coming to serve you, the chef should be vaccinated, because we want to make sure that there is a level of protection within that establishment, so that it is not said that you now are likely to be transmitting to someone who's coming into the business. And that was the intention. How it was rolled out last week, I'm sorry.
Dr. Charles urged the public to take the vaccine since it lowers the risk of serious illness and death.
People are saying, why take the vaccine if I can still get infected? And if I can still get infected, I can spread it to other people. So why should I do this? The answer is simple. If you take the vaccine, one, you have a shorter time for infection. Secondly, your transmissibility, which means the amount or the likelihood of you spreading the virus to someone else, is much less. The amount of time at which you are transmissible, so the days in which your cough or your sneeze or even you breathing and talking is contagious to other people, is much less. And in fact, just to let you know that if you are vaccinated, you are transmissible from about day 2 to day 5 vaccinated. If you are not vaccinated, you are transmissible from day 2 to up to day 8. If your immune system is not heightened, for example, persons with diabetes, hypertension, you can actually be transmissible up to from day 11 to day 14, which is why we use the science for persons who are in isolation to remain in isolation for 10 days. And if you are immunocompromised, if your immune system is not in a good shape, you have to be isolated for 14 days. So those are the things about the vaccines.
The latest COVID-19 update shows there were 251 new cases of the virus confirmed from 1,656 tests. Of the new cases, 46 individuals are under the age of 18 and the other 205 are 18 years and older. There were 840 people in isolation facilities and 7,634 in home isolation. COVID-19 has claimed 206 lives. The latest victim is a 96-year-old Barbadian woman who died at the Harrison's Point Isolation Facility on Thursday. She was partially vaccinated. Under the National Vaccination Program for COVID-19, a total of 133,835 persons, that's 49.4% of the total population, or 58.6% of the eligible population, are fully vaccinated.
There's regional and international news after this short break.
Hi, my name is Christian Paul. I'm the country manager of BCIC here in Barbados. When the COVID vaccine first came out, I thought it was an interesting and a potentially successful way for us to navigate our way out of the pandemic and a return to some state of normalcy. I took the vaccine because I have a young family. I want to make sure that they are safe and protected. I have friends, extended family, and obviously I work here with colleagues, so I thought it was a good way to help protect them and to keep them safe, as well as myself. I would encourage others to take the vaccine because I know that you can still transmit the disease even if you're vaccinated, but the chances of being severely ill or worse, dying, are significantly reduced.
Let's roll up our sleeves and get back to living.
To regional news, the Jamaica Employers Federation is making a case for some of its members to get an extension of the 120 days provided for layoff under the law. The issue was first raised during the height of the pandemic, but was rejected by trade unions. The Federation is calling for government to intervene.
President of the Jamaica Employers Federation, David Wan, argues that where government provision prevents them from restarting their business, additional time should be given. But how much time?
It's hard to put that figure on it because you never know how long the situation continues where the government says you can't open. But we've talked about 60 days, 90 days in addition to that. And again, we're open to talking about can there be a percentage of the salary during that period beyond the 120 days.
Mr. Wan says businesses across the island are still reeling from the impact of the COVID-19 pandemic. It's the reason he wants the government to intervene.
If we don't get some favorable legislation, we could be talking survival of the firm, which then means that employee may not have a long-term future with this company if it goes out of business. And again, if they have to get made redundant, it's a cost to the company.
But Mr. Wan's quest for an extension is not sitting well with at least one trade unionist. General Secretary of the Union of Technical, Administrative and Supervisory Personnel, UTASP, St. Patrice Ennis, says 120 days is more than enough.
On the international scene, a jury acquitted teenager Kyle Rittenhouse today of murder in the fatal shooting of two men during racial justice protests, in a decision that ignited fierce debate about gun rights and the boundaries of self-defense in the United States.
State of Wisconsin versus Kyle Rittenhouse. As to the first count of the information, Joseph Rosenbaum. We, the jury, find the defendant Kyle H. Rittenhouse not guilty. As to the second count of the information, Richard McGinnis, we, the jury, find the defendant Kyle H. Rittenhouse not guilty. As to the third count of the information, unknown male, we, the jury, find the defendant Kyle H. Rittenhouse not guilty. As to the fourth count of the information, Anthony Huber, we, the jury, find the defendant Kyle H. Rittenhouse not guilty. As to the fifth count of the information, Gage Grosskreutz, we, the jury, find the defendant Kyle H. Rittenhouse not guilty.
Members of the jury, are these your unanimous verdicts? Is there anyone who does not agree with the verdicts as read? Would you wish the jury polled? No. Okay. Okay, folks, your job is done, and we started just about 3 weeks ago. And I told you it could last 2 weeks and 2 days. This is 2 weeks. This is 3 weeks. You were a wonderful jury to work with.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.